Welcome back to The Bridge on WSAV. Neck pain. You know, it's something that it seems that always creeps up at some point in our life, and it's like, what can I do about it? Well, there is help available, and that's exactly what we're talking about with our coastal expert today from the Joint Chiropractic. I'd like to welcome here Dr. Kara Kalkreuth. It's great to see you, Dr. Kara.
Thank you.
So neck pain, it really is something that just kind of creeps up on us at some point, and you know, because it never fails, we're constantly like this, it seems, at our desk, at work. Who's susceptible to experiencing neck pain?
Well, honestly, that's a tough one to answer simply because no one's really immune to it. I mean, everybody is susceptible to it, honestly, whether it be babies from being born. I mean, the birthing process is very traumatic on an infant's spine, so issues can arise
At some point. So there's not a golden age that, you know, that neck pain is just going to show up. I mean, anyone can get neck pain.
Exactly.
So in thinking about that, then let's talk about some of the causes of neck pain, because, you know, I always seem to, sometimes when I wake up in the morning, I you know how you feel like you have this crink in your neck or something,
Right.
you can't turn, you know. So I know that maybe a position that you're in can cause neck pain. But
Absolutely.
what are some of the other causes of neck pain?
So posture, sleeping positions, all of that absolutely can contribute to neck pain. Any sort of physical traumas, accidents, those sort of things can, of course, cause neck pain. Any kind of sprain, strain. There's a lot of causes.
So how can a chiropractor treat neck pain?
So we can treat neck pain with spinal manipulation or instrument-based manipulation. It can be manual or hands-on, and we just, you know, we'll do a thorough medical history, we'll do a good exam, and adjust the areas of the spine that need corrected.
And you know, I for one can say, you know, we've been talking to the Joint Chiropractic for a while now because they are our coastal experts. And I had the opportunity to have my neck adjusted, and I hadn't done that in forever. And I was a little nervous about it.
Sure.
And it really made a lot of noise, and it almost scared me a little bit.
Sure.
But afterwards, I felt great. It was like this pressure just released.
Exactly.
But you know, neck pain, you don't have to be afraid of the adjustment. You know, a lot of people hear those noises and they're thinking, oh, they're going to break my neck.
Sure.
That's not going to happen.
No.
And what is that releasing, Dr. Kara, that you hear when you adjust?
So when we adjust, basically what we do is we examine you, and then we'll find areas of your spine that are subluxated or the joints are fixated, so the motion's restricted, it's not moving the way that it needs to. So we bring your joint to tension, and when we thrust and reintroduce motion into the joint, that audible release you hear is just a gas release. It's just nitrogen release between the joints.
So, Dr. Kara, let's say someone starts chiropractic care. You know, they may be a little scared about doing that, especially because it's the neck. But when can you expect to start feeling better?
I always like to let patients know starting out with care, you could feel better immediately, you might not feel different, or you could be a little bit sore starting out with treatment. It all just kind of depends. Everybody's different. Most people typically do start to feel better within the first few visits, though.
So we talk about the maintenance of chiropractic care and how it actually works, because so many people think you can go that one-time visit and everything just be wonderful and fine, and that you're just fixed. Now, why should you continue with adjustments when you feel better?
So I always like to compare routine or maintenance chiropractic care with like going to the gym and working out. We work with the musculoskeletal system just like, you know, you do with your workouts. Can you work out once and reap the benefits, enjoy better health, weight loss, whatever your goals or intentions are? Of course not. The important thing to do is once we get your spine back into proper alignment, it's important to keep it there so that you don't digress.
How do I know that I would be a good fit and I might want to visit a chiropractor?
You should know that you could be a good fit. Just honestly, come in, fill out the paperwork. We'll do a good history exam, and if you could benefit from care, we'll certainly let you know.
And we all know that here in Savannah, the Coastal Empire and Low Country, there are loads of chiropractors.
Yes.
A lot of great ones. But the Joint Chiropractic, you guys have a different philosophy. And a lot of viewers watching right now, and maybe they're suffering from neck pain every day, maybe back pain. What would you say to those viewers to give the Joint Chiropractic an opportunity, and why should they choose the Joint Chiropractic?
Well, the Joint Chiropractic is great because we're a multi-doctor clinic. So I work with 3 amazing doctors in the Savannah clinic, and there are 3 other great ones in our Pooler location. It's good to have a multi-doctor clinic because we all sort of have our different techniques and approaches, and that's really great, first of all. Second of all, the Joint Chiropractic is great because we have very convenient hours. We're open 10 to 7 Monday through Friday and 10 to 4 on weekends.
And you can walk in.
And exactly, you can walk in. We don't require appointments or insurance, so
that's the thing. It's that easy. You don't have to wait on an appointment. Right. You have something for everyone. Right. And you treat all ages, from infants to elderly.
Yes.
And that's wonderful. Well, I want to thank you, Dr. Kara, for joining us today and for all the information you provided.
Thank you.
If you'd like more information on the Joint Chiropractic or any of our Coastal Experts, just check out our Coastal Experts page. You'll find that at wsav.com.